Hi everybody, my name is Andreas. I'm the Director of Audiology at Hearing Solutions, and I'd like to talk to you a little bit today about the various ways we're looking to serve you better. This COVID pandemic has been a difficult challenge for everybody. You know, for us at Hearing Solutions, we feel a deep commitment to our patients, and we've been looking for ways to make sure that their needs have been met. Just because we're in a pandemic doesn't mean that people's hearing needs have stopped. And in many cases, people's hearing challenges have been aggravated as they're looking for new strategies to stay connected to one another. You know, more people are using tools like Zoom or FaceTime to stay connected to family and friends and other loved ones. This can often be a new challenge that is making their hearing needs more difficult. Or whether it's people resuming their activities that they're used to and finding that they're now in difficult challenges again. People's hearing needs haven't gone away just because we're in this new situation. So we felt a deep responsibility to our patients to make sure that we're still able to meet their needs and care for them, because our mandate is really to ensure that people are able to live life to their fullest and get the most out of every single interaction. That's been a hard balancing act, however, for us, because we also feel a responsibility to our patients and staff to ensure that they're safe and well cared for. And we also have this social responsibility to ensure that we're doing our part to ensure that the spread of this disease is being controlled. So managing both of those two different needs has been a little bit of a challenge. Fortunately, we have a dedicated team of health professionals that have been innovative and dedicated in making sure that we're looking for new innovative ways to make sure that the needs of our patients can be met while we're still maintaining the safety of our patients, our staff, and the community as a whole. So those are some of the various ways that we can serve you better. So the first of those that I want to talk to you about is home care. A number of patients have been unable to leave their home. This can be due to lockdown restrictions, it could be due to voluntary quarantine, or it could be due to other restrictions that were prior to this pandemic, such as limited mobility. It's my belief that these people still deserve the care that everybody else should get, and so we've looked at solutions to be able to service these people. One of the ways we're able to do that is through home care. If you're not able to come to our clinics, we are offering paid services in which we can send a clinician to you and make sure that your needs are still being met in the comfort and safety of your own home. This can be done with a patient administering a hearing test or delivering a hearing aid, for instance. So we've been able to do this for a number of different patients using this format. For patients who are concerned about the degree of contact, this home visit offers a solution where you're maybe not needing to use public transit or enter a shopping center, and so there's increased safety from that perspective as well. For people who are still concerned with somebody entering your home, we've also looked at other new solutions to be able to provide care, limiting contact even more than that. And so we've partnered with a company called Shoebox, who have an iPad-based audiometer that still produces clinically valid results, and we've been able to use that to either administer a test with increased distance, or in some cases even administer a test with no contact at all. In those instances, rather than the patient coming to your home and entering your home, we're able to, in some cases, drop the audiometer off along with instructions. An automated self-administered test is able to be completed. We then pick up the equipment again and can complete a consultation through either a video conference or a telephone call, and we're able to, in that manner, be able to still complete a test with limited or even no contact at all. For patients who don't necessarily want someone coming to their home, we're also offering some similar curbside services where you'd be able to arrange an appointment, arrive at the clinic, stay in your car. The clinician would come out, hand the equipment through the window. Again, you're able to self-administer the test, pass the equipment back throughout the window, and then we'll be able to follow up using phone or video conferencing afterwards and do a consult in that kind of fashion. And so I believe that through using technology in this way, we're able to span distance and still arrive at a solution. I don't believe that people need to delay care any more than necessary, because all the data shows us that it's too easy for us to ignore the problems. And as I said earlier, just because COVID's happening doesn't mean these problems have just gone away. Modern hearing aids have also really supported us in our ability to serve patient needs in the comfort of their own home. Many hearing aids are allowing us to, through a smartphone, used as a bridge essentially, connect to a patient's hearing aids. We can again establish a video conference, and we're able to make adjustments to patients' hearing aids while they're sitting at home and they're safe and they're comfortable. And being able to make adjustments in this way is also being able to make adjustments in the circumstances where people are maybe encountering their problems or living. And so this also makes it a very, very customized solution. In some instances, we don't even need new hearing aids. Many people, they might not even realize it, but they're wearing hearing aids that already have this compatibility. This isn't something that Hearing Solutions has just introduced now. We've been doing this already for a while. In fact, last month we published an article that talked about some of the data we collected over the last year on using remote services tools such as this. So it's an exciting way in which we're able to, again, meet people's needs without them having to come into the clinic, and often there's backwards compatibility. Curbside care is another way that we're able to deliver care to people. This means people are able to make an appointment, arrive at a clinic, and they're able to have the clinician come out, get the hearing aids, perform a repair, and again we're able to have contactless interaction, which is really exciting for a lot of people. As the province opens up, there's going to be more people interested in visiting our clinics live, and so we're certainly opening more and more clinics all the time, and we want to ensure that anybody who is visiting a clinic live is well looked after as well. We've introduced robust screening measures, so we're screening people at the time of booking, at the time of confirmation, and again at the arrival of the clinic. We have plexiglass screens to ensure that screening is done safely. We're able to take infrared thermometer measurements at the appointment. We're having staff wear masks, and also providing masks for patients visiting the clinic as well. We've spaced appointments in a manner so that we're limiting the risk that patients will have any interaction with one another, and also providing gaps in between the appointments so that we're able to ensure that everything is disinfected between visits. And so with these and a number of other policies that we've had in place, we're able to ensure a safe environment where people are still able to have their needs met. We also have our screener on the website, and so for people who are earlier in their therapeutic journey, we would encourage them to use that as a starting point, because we can use that data to again start any number of these steps in the process. For patients who have existing problems, whether it's cleaning, batteries, lost hearing aids, anything like that, we're also serving patients' needs. So make sure you visit us on the website, or you can contact us through our helpline 1-855-872-0130. You can also reach us by email at clinic@hearingsolutions.ca. So regardless of what stage in the therapeutic journey you're at, Hearing Solutions is here to serve you, and we have various ways in order to do that better in these new times. Thank you.